Hi, everyone. Welcome. I'm going to give it a few seconds for everyone to come in from the waiting room, and then we'll get started. All right, welcome again, and thank you so much for being here today. We'd like to start by extending a special thank you to Galen Hope for sponsoring today's webinar. And the topic of today's session is Too Much of a Good Thing, Understanding Exercise Addiction and Compulsive Exercise. This is a topic that frequently comes up in our caregiver support groups and on our forums, so we're really fortunate to have Dr. Amy Boyers here today to share her knowledge and help us understand how exercise addiction and compulsive exercise can impact eating disorders all the way from diagnosis through treatment and into recovery. And I'd like to go over some quick housekeeping guidelines, and then we will turn it over to Amy. Please keep your cameras off and your microphones muted throughout the presentation. And if you have any questions during the webinar, feel free to drop them into the chat box. We'll save some time at the end of the webinar today for questions and answers. And as time allows, Amy will answer as many of those as she can. And with that all being said, I'm going to turn it over now to Amy.
Thank you so much. Thank you all for being here today. I really appreciate your interest and your coming today. I am Dr. Amy Boyers. I am a clinical psychologist, and I have worked in the eating disorder space for over 2 years. For many years, I was in private practice, and I am fully trained in FBT. About 4 years ago, I opened Galen Hope, which is a treatment center in Coral Gables and in Delray Beach. My partner in Galen Hope is Dr. Wendy Oliver Pyatt. Some of you may be familiar with her name because she owned Oliver Pyatt Center at one time. And she and I also created the Clementine program together. So I have a long history of working in this space, working at various levels of care. And I'm very happy to be talking with you all today. Judy had asked me to talk about, I'm just going to share my screen, had asked me to do this talk on exercise addiction. And I was like, great, no problem. But it was a talk I had never done before. And so it's been an interesting experience for me to prepare this talk for you all, because it gave me an opportunity to really take a bird's eye view of where our field is in understanding this phenomenon. And so while we will talk about exercise addiction and how this relates to eating disorders and the intersection with eating disorders, I think it's also an interesting conversation to talk about where the field is in understanding this, where the limitations are currently in our field. And that's often my approach when preparing talks, is not only what is it, how do you treat it, but where is there still room for growth in our field? So please feel free to put questions in the chat. We will get to them. I really appreciate and enjoy questions. I feel like it really helps to bring the talk to life, and I want this to be relevant to the experiences that you are having. So if you feel like there's something I could spend more time on, please let me know. So we'll get started. I just need to clear my screen a little bit. So there's a lot of ways that exercise addiction is discussed in the literature, and the words for it are used. There's a lot of different terms that we use for exercise addiction or excessive exercise. And to some degree, they have different definitions, and to some degree, they're used loosely to all kind of mean the same thing. But after doing a pretty comprehensive search in the literature, exercise addiction is kind of the broadest term. It refers to a loss of control over exercise-related behaviors. And so this is when you see people exercising when they're sick or injured, and it interrupts normal functioning. But this To date, exercise addiction is not its own diagnosis. Um, Sometimes you might hear the word process addiction or behavioral addiction, things like gambling and gaming. Um, Compulsive shopping. Um, and so it gets kind of lumped into that. But it's a little tricky because there are medical issues that you see in exercise addiction that are more typical of eating disorders than of um, substance use disorders. And so this is one of the first issues that comes up with exercise addiction is that sometimes individuals who have this problem don't really fall into a treatment center box. That the addiction facilities do not have the medical expertise or the psychological expertise to address the components of exercise addiction that really overlap with eating disorders. And sometimes the eating disorder programs don't have the expertise to deal with the exercise component, or they don't have a protocol in place to help people return to normal exercise. So another term you hear a lot is compulsive overexercise. That's when somebody uses exercise as a coping mechanism to push away unwanted feelings. It has that kind of OCD feeling with it. They're using exercise to compensate for eating. And then you may hear the terms bigorexia or anorexia athletica. So people who are have some degree of body dysmorphia and are working out a lot to change the appearance of their body, and they're overdoing it, not recognizing that they may actually be becoming too muscular. Um, Sometimes you hear the word pathological exercise, dysfunctional exercise, and what I discovered in the literature is that they use all of these terms. You can go back about 50 years and there are descriptions of this behavior and studies on this behavior dating back a long time. A lot of the research began, and it's interesting because it kind of follows the trends in exercise. The research began really on runners. That was the first group that I really saw any kind of research being done on this, and a recognition that there are some people who run in a way that is pathological or disordered. So I am going to talk about specifically defining exercise addiction, but at the same time, understanding that in our field and in the literature, they blend these concepts a lot. It's often not clear exactly what they're talking about, other than that, they're talking about people who have a disordered attachment to exercise and working out. But I think it's important to talk about exercise addiction as a phenomenon because that does seem to be more clearly defined than some of these other terms. Um, and some of the issues with understanding what exercise addiction is and studying it is the concept of discriminative validity. And so when we study anything, we want to be able to identify it as a discrete disorder. And the problem with exercise addiction or compulsive exercise is that there's a high overlap with eating disorders. And in some cases, people are trying to make the case as they grapple with what is this phenomenon? Is it really different than having an eating disorder? Is it really distinct, or is it really something that is subsumed in the construct of eating disorders? Because there's so much overlap, it's hard when you administer a measure that asks questions about symptoms and behaviors and feelings you may have. There's a high amount of overlap with eating disorders. So it's very hard to extricate this from a research perspective from eating disorders. And in my opinion, eating disorder specialists are the best people to treat this. I thought this was interesting. In all my research, I found out that Eminem, the rapper, had an addiction to exercise, and this described his experience with his exercise addiction. And I think it's very typical. I got an addict's brain, and when it came to running, I think I got a little carried away. I became a hamster, 17 miles a day on a treadmill. I started getting OCD about the calories, making sure I burned 2,000 every day. In the end, I got down to about 149 pounds. I ran to the point where I started to get injured. All the constant pounding from the running began to tear up my hip flexors. I guess I'm pretty compulsive working out. And so this is someone who kind of fell into this, and you see it started to overlap with eating disorder thinking, using it to compensate for having eaten. So just some basic features. I think if a person in your life is engaging in exercise in a way that bugs you, it makes you uncomfortable, it's getting your antenna up, that's where you start. I always think listening to yourself. If this is a person who is close to you, that you have a deep relationship with, you need to listen to yourself if something doesn't feel right. I think we can often doubt ourselves or rationalize away the behavior. And um, and then in the end, we say, ah, I should have listened to myself. I knew something was wrong. So, what are things that you might hear that they express guilt or anxiety when they can't exercise as planned? Sometimes that guilt or anxiety can lead to real dysregulation if they don't get to engage in the behavior. They'll continue to exercise even when they're injured, they don't rest enough. Part of intensive exercise, part of doing it well, is giving your body a recovery period, letting it rest, fueling your body correctly. So the point of this talk is to in no way demonize intense exercise, but it needs to be done properly. You need to give your body the proper nutrition and the proper rest so that you don't get injured. If someone is engaging in exercise in secret because they know that people around them disapprove or they've been told not to, right, then we're probably looking anything done in secret. I think for all of you who have loved ones that are struggling with eating disorders, being secretive and shame, those two things kind of go hand in hand. Others begin to express concern, especially at the gym. A lot of times the employees at the gym fully know who the individuals are that have a disordered relationship with exercise or maybe have an eating disorder. And often they don't say anything because liability issues or they've been instructed not to. I've heard of even people being asked to leave gyms because they don't want the liability that comes with someone who is uh, engaging in overexercise. Um, there is a point at which overexercise will impair your athletic performance. So if this behavior is being seen in someone who is a serious athlete, the overtraining will actually impede their progress. If you are having to change your plans to accommodate this person's need to work out, that might be an indication that there's a pathological relationship there. And then they'll exercise in inappropriate settings. At Galen Hope, we even see this. We recently caught one of our clients doing squats over the toilet. And so they will exercise in inappropriate settings. So like, as I said, in the bathroom or in environments where they have no idea where they are and they can get lost or they could go through an unsafe neighborhood. And they care more about their exercise than they do about safety or about the needs of the people who are on vacation with them. They don't care if it makes everybody late, or everyone has to wait for them repeatedly. They have to get that in. Um, so exercise addiction, when you look it up, many people talk about it as having the same components that you find with other addictions. So salience means that it's this thing that is really dominating their life. It's becoming the most important thing in their life. It's their central focus. They use it to modify their mood. And a lot of people might say, well, hey, when I work out, I feel better. um, that's okay. But you're not doing it to avoid negative emotions. So it's one thing to kind of, burn off a little stress at the end of the day. It's another thing that you're doing to avoid dealing with problems, that you're spending more and more time engaging in the behavior as a way of numbing out and not dealing with perhaps some very serious issues in your life. So tolerance, they have to do more and more in order to achieve the same effect, especially if they're achieving some kind of a high. They'll have to keep doing more and more. And it's going to be hard to do that the more they exercise, especially if they're not giving their bodies adequate nutrition. Withdrawal, so they experience oftentimes like anxiety and agitation when they can't exercise. They can become tearful and irritable as well. So just like someone withdrawing from alcohol or drugs, you can see this with exercise as well. And you can see they get physically agitated. They'll start pacing and things like that. They can become pretty argumentative. I mean, we've seen that here at Galen Hope. Conflict with self or others related to use. So loved ones, coaches, friends at the gym, doctors, physical therapists, they will all be engaging in conversations with this person that this isn't healthy. You need to give your body a rest. This is taking up way too much time. You're too focused on this, and it's becoming problematic in their relationships. And then relapse, that they can't stop doing it. They may be able to abstain for a period of time. They may be able to agree, yes, this is a problem, you're right, I'm going to try, and then they slip back into the behavior. So it's hard to define, but we know it when we see it. And I think one of the things to talk about is someone like an Olympic athlete. So exercise addiction is different than exercise done at a high frequency. Somebody who is an elite athlete, somebody who maybe does it for college, they will spend a lot of time doing this. That the training required is a lot, and they do sacrifice other parts of their life in order to achieve at this level. And because of the degree that they train and exercise every day, they may experience withdrawal, but it's not something that they're doing in secret. They do focus on their health and well-being, and they do typically have other interests in their life. They care about their relationships. They care about what other people have to say. And so they're not chasing the high. Another thing that's very common in exercise addiction is you will see other addictive behaviors. Typically, the exercise addiction doesn't exist in isolation. It's part of a greater picture of maybe other addictive behaviors, or eating disorder behaviors. So, so people who are addicted to exercise, they're chasing the high. That's that intrinsic reward. So it's part of their identity. It's a central part of their life. They're chasing that high. Whereas people who are committed exercisers, so people who believe that exercise is part of being healthy, they do it for the extrinsic rewards. So exercise is important, but it's not central. So the extrinsic reward might be that I get to see my friends, or, I'm improving some aspect of my health that I needed to. And I have fun when I do it with my friends. It's social. So it's not about, this is who I am as a person, and this is my sole focus in life. So committed exercisers have healthy relationships, they maintain their jobs, and it doesn't come with this functional impairment that an exercise addiction has. So some statistics about problematic exercise, and I'm going to jump around and use different terms, because if I'm using a different term, it's probably how it was described in the studies that I'm citing. So this is a large study, and so we see here it's a fairly common phenomenon. 11% of men, 17% of women reported compulsive exercise. And again, in this study, so compulsion is a component of exercise addiction. And so for people who endorsed compulsive exercise, more likely to have poor mental health and substance use behaviors. And another study on exercise addiction, and again, they're all over the place with the prevalence, 6.2%, higher rates in general exercisers as compared to amateur competitive athletes. Again, that might be because the competitive athletes are doing it for more of an achievement reason. They're spending a lot of time doing it, but it's not an addiction. And then there's just there were some interesting statistics on subgroups of different athletes. So you can see that the endurance and the runners, very, very high prevalence. But it's also important to say, like, yes, 5% of CrossFit athletes may meet criteria for exercise addiction, but 95% don't. So again, this isn't trying to demonize them for doing this kind of exercise. So just some research issues that I found. So dysfunctional exercise. So does it meet criteria always for exercise addiction? No, but there's a problematic, disordered relationship with movement and exercise in the range is 22 to 80%. But I think the bottom line is we're seeing a lot of it. But this I thought was a really important statement, that compulsive exercise is one of the most significant predictors of chronic outcome and quick relapse in anorexia nervosa. And I think this is really an important point for those of you that are in the midst of dealing with eating disorder treatment for a loved one, understanding that if they have any kind of disordered relationship with exercise and it is not addressed, or if we're pushing to get them back to a sport without fully understanding their relationship with movement and how that is connected to their eating disorder, because often it is, we are setting them up to have an eating disorder for the rest of their life, or to relapse and wind up back in treatment again. And I know for a lot of our patients, they often are involved in sport, or they come from families where exercise is a part of the family culture. And so it's not that eating disorder professionals aren't supportive of exercise, but if we don't acknowledge the relationship between the exercise and the eating disorder, if there is one, it's a really good setup to have an eating disorder for the rest of your life. And it will look like someone who's obsessed with exercise because it was sanctioned and approved by their family members. That these individuals, so this all comes from the literature, that they're more likely to be looking at fitness and thinspiration content on social media in an obsessive manner. So this is a reminder that if your child is struggling with an eating disorder, definitely be aware of what they're looking at online. Yeah, and again, there's a lot of debate as to whether or not exercise addiction is the same or different than an eating disorder. So there's primary and secondary exercise addiction. So the primary exercise addiction is you have an exercise addiction, but you don't have other disorders going on, and it's chasing that high. It's related to the exercise itself, whereas secondary exercise addiction is it exists in the context of another issue. So you could have really severe anxiety, you could have body dysmorphic disorder, you could have an eating disorder, and the exercise addiction or the problematic exercise is in service of that. It's helping you to alter your mood. It's helping you with your weight. It's helping you to change the way your body looks. And that is in service of the eating disorder. Whenever we look at any kind of psychological conditions, we tend to use the biopsychosocial model. And I mention that just because I think it's important to talk about the complexity of these illnesses, that they that there's the biological piece, there's the genetic piece, there is the home we grow up in, the society we live in, the exposure to all this information that idealizes thinness and fitness, and you're supposed to eat this way, and then any other mental illness that may be on board. And so treating these things is not simple. It takes time to go through the various layers and identify what is reinforcing or supporting this person in continuing this behavior. Um, so who's at risk to develop a problematic relationship with exercise? If you've been diagnosed with an eating disorder, you are 3.5 times as likely to demonstrate exercise addiction than individuals without an eating disorder. And having worked in this space for such a long time, eating disorders can morph over time. And so while they may not have exercise as a component of their eating disorder when they are young, it can turn into that as they get older. If the eating disorder is not fully treated, because exercise is something that is so lauded in our culture, that if someone exercises a lot, our impulse is to say, look at you, you're so fit, you're so disciplined, I wish I was like you. And so people can get away with this behavior and fly under the radar for a really long time, before people realize it's a problem, or before they begin to experience problems with their health or with their relationships. So in the triathletes, elite athletes, more common to find it. We don't really have a ton of research on, like, what ages are most likely, but we seem to know that it's more common in young adults. Also, comorbidity with other diagnoses. Um, so it seems that there's a component of depression in people with exercise addiction, and depending on, like, what kind of exercise you do, how much depression is involved. They found some differences based on the type of exercise you do. Um, so obviously, what people who struggle with negative body image and eating disorders. Um, and the poor nutrition is really a problem if you're also over exercising, and they make poor decisions. Personality factors, so people who score high on measures of narcissism, perfectionism, psychopathy, grandiosity, these features. Impulsivity, alexithymia, that should be a term you've heard before, the inability to describe one's emotions. That's a very common symptom of eating disorders, particularly anorexia. Um, and negative urgency is when you feel like you need to act when you feel something negative, and sensation seeking. So these are personality factors that we see in people who struggle with exercise. Um, High level of prevalence of OCD. So this concept of obsessive passion versus harmonious passion, um, I thought it was an interesting concept. So harmonious passion is when you're doing something because it gives you purpose and meaning, and it gives you a lot of joy, and you get into that flow state. And how do you differentiate that from obsessive passion, when it becomes more pathological, more rigid, more interfering with your functioning? I just thought it was an interesting concept, because I think people can use the language of, I just love it, I just love it, but is it really just that you're obsessive and rigid about it and you're unable to stop? Because if it's something that just gives you a lot of joy and meaning, you should be able to stop, and you should be able to focus on other relationships and other things that give you joy. If it's obsessive, the other aspects of your life should start to shrink. Oh, yes, the bidirectional influence. So, exercise naturally lifts people's mood. Um, but also, and so they'll use the exercise to do that if they have a depressive disorder. But also, if you're exercising a lot, it's very hard to keep up with the nutrition, even if you're trying. So if you're not eating adequately, or if you're actively restricting or purging because you have an eating disorder, it's going to make you more depressed. And if you believe that it actually is good for your mood, you're going to get caught in a cycle of wanting to use more exercise to improve your mood, but the poor nutrition and the demands on your body are actually causing depression. So you get caught in a loop there. So I did find a scale to measure exercise dependence. See, another new term. So you're seeing our field has not come to an agreement on how to describe this phenomenon, but I put this up there because I think it would be helpful just to see the questions they ask, and to see if, any of these questions would be answered yes by your loved one. So I'll give you a second to look at this questionnaire. Or does it resonate with you? Is this something that you struggle with? And I think whenever we have a loved one who's getting treatment for an eating disorder, it's also a time of reflection for family members, for people who are providing support. To what degree might I be modeling this? To what degree is this actually something I struggle with? So I put these pictures up here because it's important to acknowledge that this took me 1 minute to find these images on Instagram. And by the way, now my Instagram is filled with these images because I went looking for these for my talks. But this is what people are looking at. And this one on the left, Dan Bilzerian, if you notice, first of all, everyone else is dressed in this picture. But also, this guy posts a lot of images of himself working out, not dressed, and kind of living a very glamorous Instagram kind of lifestyle on boats with girls in bikinis. So that they're conflating the idea that if you work out a lot and you're in great shape, like you're going to have this amazing, glamorous life. This guy on the right, Dylan McKenna, he's a fitness guy on Instagram, and he's posting different pictures of himself. Which physique do you like best? Showing himself with different amounts of body fat. And this is what young men are looking at and using as guides to work out. And so this we have to take into consideration, that this is seeping into their consciousness. Women are not immune either. We see this. I just literally grabbed these off the internet of people showing their workouts. Jennifer Lopez constantly putting pictures of herself in bikinis, also workout photos as well. So it's very normalized to be in the gym all the time, and that if you do it, you're going to be glamorous like these people on Instagram, like Jennifer Lopez. So what are some of the neurobiological mechanisms that support what happens in the brain, in the body? Why does this happen to someone? And there's different postulated models. None of these have really been fully fleshed out. Some of them have more evidence and research to support them than others. This affect regulation hypothesis, I think, intuitively makes a lot of sense. But it does increase catecholamine. So it is increasing some of the neurochemicals in the body associated with pleasure. And that people, we know people use it to make themselves feel better. And so is it possible that there are mechanisms in the brain that are actually supporting this, like addiction? This one, the anorexia analog hypothesis, it was discredited. It's not one people really think is valid anymore, but you might see something about it. And I always like to let people know when there's a discredited theory out there. Sympathetic arousal or habituation hypothesis. We see this. We know this is true, that part of it is that they're looking to get that feeling, that blissful feeling that comes with working out a lot, and they have to do more and more of it in order to get that feeling. The beta endorphin hypothesis, that fats converted to energy release endogenous opioids. I think that's a really interesting one, so that it's a natural byproduct of just working out, and maybe some people's brains are more sensitive to that. and the cytokine hypothesis that it causes releases of anti-inflammatory chemicals in the body, and that also feels good. So there may be things that are natural consequences of exercise or over-exercise that are supporting this. This is a very long quote, but I thought it was just very beautifully written. And I thought really described what goes on. So for certain sport perfectionists, the repetitive training, the body's addiction to movement, the ritualization, and the obsessive but conscious repetition of gestures can organize themselves in a compulsive manner. Addiction to muscular exercise. The population of highly physically active individuals feels the need to fill a thought vacuum or a vacuum of affection. And in this case, the designated objective is sport and exercise. This addiction often manifests itself in a need to practice his or her specific gesture with no respite, to continually verify the mirror image and the image projected to others. So the feedback they get from others plays a role. To some top-level athletes, sport intervenes in the same manner as a drug acts as a remedy for physical or psychological pain. Thus, exercise practiced on a daily basis and in a repetitive manner may prevent painful thoughts and will anesthetize in the same way as heroin does. I just thought that was a really powerful statement and thought-provoking. This idea of a thought vacuum or a vacuum of affection. So I think it's something to think about. So one of the main reasons why people experience medical complications related to overexercise is because of inadequate caloric intake, which obviously, again, overlap with eating disorders. And so if they're actively restricting and they are physically active, that's a very dangerous combination. So in the context of exercise addiction, they may seem to be eating. You will see them eating their meals, but it might not be enough for the demands being made of their bodies, or it may not be appropriate. When you are training at a high level, there is specific nutrition that you need to have pre and post workout in order for your body to recover sufficiently to do that training again the next day. So you will start to see many of the issues that we see in people with eating disorders, with starvation. So even though, and this is where it gets confusing because we think, I see them eating. He seems to be eating a lot. But the amount of exercise far surpasses whatever they're eating. And if you're not a dietitian or a doctor, you may not realize that. And you may not be around them all the time. So this low energy and availability, which is essentially not eating enough, the body's forced to adapt and conserve energy wherever possible by no longer performing non-essential functions like getting your period, your hair may start falling out, mood regulation or executive thinking. You're even on a cellular level, you may impair your body's ability to work on a cellular level, immune system decrements and immune system functioning and cardiovascular capacity. It's very interesting. I had a athlete who I worked with in my private practice many years ago. She had what was called an AV node block, and she was being followed by a cardiologist. Dad's family did have some kind of cardiovascular history, but it was not this particular issue. And she was playing basketball and exercising a lot and restricting, very low weight. And everybody, including the doctor, believed that she had a cardiac issue. And she was really the only one that understood she wasn't eating enough. And I kept saying, I promise you, this is going to go away when she is nutritionally rehabilitated and in her proper weight range. And lo and behold, that was exactly what happened. But the medical issue diverted everyone's attention away from the fact that she wasn't eating enough. And if you aren't an eating disorder specialist, you're going to miss it as a doctor. So here's a number of the medical complications associated with overexercise. And you can see there's, I mean, there were many more, and many of these are the same ones that you see in people with severe eating disorders. One of the things that people talk about are overuse injuries. You will see this sometimes in elite athletes innocently, but these repetitive strain injuries or overuse injuries, they are often, like, you see them often in like baseball players. You'll see a rotator cuff injury if they're a pitcher. Makes sense. But it's different than what you see for people with exercise addiction. It's not like that. It's not like the part of their body that gets a lot of overuse because it's part of the sport. You see stress fractures, tendonitis, you get the deconditioning, poor healing, rhabdomyolysis. You don't see that in typically in elite athletes. In elite athletes, you see a predictable pattern of injury that is associated with that specific sport. And I can tell you that these do not age well at all. And I have seen this also turned into complex regional pain syndrome for older women who have particularly a history of dieting and restricting and over exercising. So these do not age well. The longer this goes on, you see people really getting injuries and medical issues that you associate with old age, and you see it in women in their 40s. So how do we treat pathological exercise? Some of the challenges are that there aren't a ton of programs out there that specifically treat exercise addiction. I think a lot of the time there is a lot of overlap with eating disorders, and so they can go to a traditional eating disorder program, and often they can treat it, but not all programs even have specific protocols. Not all programs have um, programs related to pathological exercise. So if that is a big component of your loved one's eating disorder, then you need to be asking questions about how well do they treat this? How do they understand this? What do they do with it? Do they have staff members that specifically work with these clients? Do they have protocols for this? Um, and so these are important questions to ask. And also, if it's happening, if it's really just an exercise addiction without a lot of other eating disorder stuff going on, sometimes they wind up in a substance use facility, an addiction facility, and they may not really feel resonance with the other clients. And again, everyone's presentation is different. They may not fit so well in an eating disorder program. And the problem with the substance use programs is they have no real medical or nutritional expertise to support this individual in their recovery. It's not just dealing with the behaviors, but helping their body heal. Stopping the exercise obviously helps, but they also have to be nutritionally rehabilitated. And a lot of times these individuals have very rigid ideas about how they're supposed to be eating that come from the fitness world, and they are really unhealthy and inappropriate. And oftentimes the substance use programs just have no comfort level or expertise in this. So I believe an eating disorder program more often than not is going to be a better fit. So in 2016, there were some guidelines published about how do you work with problematic exercise, and work on reintroducing exercise in the context of eating disorder treatment. And so these are some of the guidelines that they talked about, which is that, you want to work as a team. So there's a dietitian, there's a doctor, maybe there is an occupational therapist or a trainer involved, the therapist is involved, and everybody understands a different facet of this problem for this individual. And they come together to create a plan that makes sense for that individual and how exercise or sport fits in their life. Obviously, you have to deal with the medical concerns that could create contraindications first. If they have a stress fracture, they can't be exercising. That has to fully heal. If if they have tachycardia, like all that stuff, the medical stuff has to be addressed first before you reintroduce any kind of movement. And you create a graded program. You don't start with super intense exercise. You build slowly and you continue the conversation. You're checking in with the client about how they're feeling, if any urges are coming up. And there needs to be a lot of conversation when they can't exercise about how they're feeling. This may be the first time that they haven't used this behavior to modulate their feelings or to avoid certain problems. It can be very uncomfortable. Doing a lot of education with them and their loved ones around uh, the medical piece, around what is exercise addiction and why do you believe that this is an exercise addiction or a compulsive exercise? How does it fit? How do these pieces of the puzzle come together? And this debriefing is when they do an exposure, you have to debrief afterward. You have to have a conversation with them immediately afterward. How did it go? It's great if you can have someone watching them in the beginning to make sure they're not doing anything compulsive or disordered or pushing too hard. And then I added the insight into function. Ultimately, the guide is really understanding what is the function of this behavior in my life? What is it doing for me? And how can I meet my needs in a new way? If they don't express insight into how they got to this place, you haven't really completed treatment. They may be able to stop, they may be able to understand that they took it too far, but why? Why is that part of their story? They need to get to a place of understanding, because once you understand the deeper issues that are driving that behavior, you can find new ways to meet those needs. Just these are my thoughts on interventions for and treatment for overexercise. Um, Sometimes people just need to go to a program because they are physically prevented from engaging in the exercise, that they have monitoring and support and structure there, that it can just be very hard to implement at home. The client needs to be able to recognize the negative consequences, and they need to express a desire to change. If they just continue like a broken record that exercise is healthy and I need to be fit and you just want to make me fat, that, prognostically is very, very poor for them. If they can't understand that this is a problem and that it's part of a disorder, that they have a disorder, the behavior is not going to stop. You're going to wind up right back there. Um, this is often a hard conversation. Is that the sport that they have been involved with ever possible again? It is not uncommon for teenage athletes who present to treatment at an eating disorder facility to acknowledge at some point, this stopped being fun for me a long time ago, but I'm good at it. It may help me get into college. My parents are super invested in it. I feel like my parents have a lot of expectation. They're counting on me to keep doing it so I get into a good school. My parents would be disappointed if I stop. And so this can often be a big source of resistance, because a lot of times these kids have high levels of achievement in this sport, and the parents naturally want their kids to be able to take advantage of any opportunity coming their way, but deep down the kid hates it. They are miserable. And so it becomes rather something they enjoy. It becomes a tool for their eating disorder. So they're exercising and training a lot, but it's in service of their eating disorder to help them lose weight.
Amy,
So
we're at the 10-minute mark right
yep,
now. Just wanted to let you know.
yep, I know, and I think I'm right on time. So, and so Supervised movement is helpful in the beginning. So if you're going to work with some sort of coach or trainer, or maybe somebody on the team can help supervise, they need supervision in the beginning, because that disordered thinking will sneak back in when no one's looking in the beginning. They need to be held accountable. Maybe you start with you get to take a walk 15 minutes twice a week. Start very small. That may be nothing compared to what they did before. It doesn't matter. You have to be thoughtful and intentional and systematic when you reintroduce it, and you don't want to reintroduce it because they've just bugged you so much and insisted so much. You want to introduce it at a time when their body and their mind is ready to handle the responsibility that comes with it. And so we want to focus on movement that you find pleasurable, that's fun, that gives you joy. Maybe something that you can do with others in a class. And especially if they come from the world of competitive sports, this may be really new for them. Maybe we have them take a dance class or take a spin class, something that's really different than what they were doing as part of their regular training, or that was part of their obsessive exercise before. We need to understand people, places, experiences that may be triggers. For some people, it's I can't go back to the gym. For some people, it could be a coach that drove them too hard and encouraged disordered behavior. It could be a family member that's a trigger. So all of that needs to be well understood, and the person needs to be able to say it and acknowledge it. And so sometimes we start with things that they've never done before, that they're not good at. Maybe you've never played tennis. Maybe we start there, and hey, that's kind of fun. But it's not about being good. It's about moving. It's about having a good time and seeing, can you do that for the sake of just enjoying it and being healthy, and not to lose weight and get obsessive about it. For some people, taking a class is better because it has a start and an end time, and they just know, like, that's better for me. I take my dance class and I leave. For some people, they know they have to go to a studio and it only offers classes and there isn't a gym, because then they'll get on the treadmill and run obsessively for 2 hours. So uh, really taking the time to understand what's going to make this worse or better as we reintroduce exercise. And that's different for every person. So in my opinion, the mindful eating and movement really is kind of where it's at. This comes from like intuitive eating. But these are the reasons why people should exercise. This is the attitude that people need to take when they're exercising. Respect physical sensations. If you're tired, stop. If something hurts, stop. Are you really enjoying this? Is this fun for you? Are you doing this because you want to lose weight, or you're doing it because it's fun? So what do you do if you think your loved one has a problem with exercise? As I said in the beginning, trust your gut. Seek consultation with a qualified eating disorder specialist, and show your loved one you're taking this seriously. Uh, Not just like, hey, you should probably exercise less. Like, actually, I've made you an appointment with a doctor because I think that this injury is really a problem. I think it's related to how much you're exercising. I think it's too much, and that you're not going to back down. Don't allow things like school or camp or some sort of special sport camp that they're going to go to for a week over the summer get in the way. If you're going to go to the trouble of working with a qualified team or putting your child in a program, um, see it through. See it through to when the team agrees things are better. A lot of people try to shoehorn treatment in between activities, but in between the end of school and the start of the new school year, or the end of school and the start of camp, or they have a job or an internship that's starting in a couple months. Like, the process is what it is. And we never know how complicated a case is going to be until we've been working with you for a while, and it might take longer. But if you pull them mid-treatment to get them back to a camp or to start practice with their team, what you are communicating is, I care more about your sport. I care more about your achievement in sport or the scholarship that you may get than your well-being for the rest of your life. And so that message comes through loud and clear. And so it's very important to stay committed, even when it's hard, even if there could be some losses associated with that. And I'm not saying that lightly. I understand that for a lot of these individuals, there are real losses here, loss of identity, loss of teammates, loss of opportunities. But those mean nothing if your child has a heart attack on the field and dies. It's important that you put it into words, you express concern. This doesn't feel normal to me. We can talk about it, that they can share things with you that are hard to hear, and that I can accept it. I can hear it. I'm not going to lose my mind. I'm not going to break. Even if it makes me sad, I can be sad and still help you. I can still stay present in this conversation. Just a quick review of the different levels of care. That these are options depending on the combination of symptoms and issues presenting, depending on how low weight they are, depending on what the medical workup shows, depending on their ability to control their urges. Some may need higher levels of care. Some may be able to do this outpatient. When do you consider a higher level of care? Obviously, if they're very medically unstable, they may need to go to the hospital. If a person doesn't have adequate social support, where they can't get support and do this outpatient, have people around them to help keep them accountable. If this has been going on for decades, it may be really hard for them to do this outpatient. It's just become such an ingrained part of their day-to-day life. They really might need that structure to physically prevent them from engaging in the behavior. If the behavior evolved very fast and became very, very severe quickly, it may be hard to catch up outpatient. They may need a higher level of care for a period of time. If a person is really going alone and they don't have family members around them to support them, if the family members have good insight into what the problems are and they're like, yeah, we get this, we know this is a problem, but the individual doesn't, that you might be able to manage that outpatient because they have people around them telling them the truth and to keep them safe. But if they have poor support, and low insight, getting them into a higher level of care may make the most sense. Or if you've been at this for a long time and you're not meeting the treatment goals, if someone's being very dishonest, they're saying the right thing in treatment, but then when they're alone in between sessions and no one's seeing them, they're continuing the behavior and lying about it. If you, as a family member, you've been at it for a long time, you've been pushing and begging and trying, and you've been doing a lot of things, and you're just burnt out, and this is starting to dominate your life, you're starting to lose your own mental health, you've explored a lot of outpatient options, and it's just not working, and you're starting to feel suffocated by this, that might be a time where your family needs to consider a higher level of care. And then any kind of unusual behavior. So we've talked about what are the kind of usual behaviors associated with overexercise, but sometimes people have very bizarre behaviors that you don't see very often. And sometimes that's an indicative that there might be a more complex psychiatric picture there. And it's more than just eating disorder with too much exercise, that there's a more complicated psychiatric picture that needs more support. So what can we do? We can teach our kids to appreciate what their bodies can do, what our muscles do, that what our organs do, that body fat isn't just something you can see, that it's important. It can coat your nerve cells and your brain cells. So we want to teach them to love what their bodies can do, and what Mother Nature has given us is amazing. And that's how we want to talk about our bodies. Not that they're fat and that I look like crap in this outfit, that our bodies are amazing. Teach them how to take care of their bodies. That yes, exercise is good, but so is resting. So is eating is important. Having fun. That if they're having obsessive thoughts about food or exercise, they need to ask themselves, like, are you hungry, angry, lonely, tired? Like, is there something else going on?
We're just about out of time, Amy. I don't think we're going to have time for questions. Do you have one really quick last kind of conclusion statement before we go?
Um, well, I think though, I guess my concluding statement is that um, exercise is a very misunderstood issue in our society. because it is looked at universally as a good thing for many reasons, and that's valid, but it can often obscure the fact that something very, very serious is going on in the background. And I guess I always just like to leave parents with, you know, your loved one the best. And if this is bothering you, you need to check that out. I always
Mhm.
listen to parents, and you know when something isn't right.
Yeah,
So
thank you so much. We're at time, Amy. Thank you so much for all of your information. And before we wrap up, I just wanted to give a quick reminder that Feast relies on the generosity of our community to continue offering educational programs like this one. So if you enjoyed this or any of our other programs, please go online and if you're able to donate. And we'd also love for you to join us for our next webinar on Wednesday, June 18th. And the topic is going to be supporting without stigma, helping loved ones heal from binge eating disorder. Amy, thank you again so much. That was so interesting, so much great information. We
um,
really appreciate you being here, and also Galen Hope for sponsoring this.
sure. Now, I'm happy to answer some of these questions on the chat if people want to stay after, or I can answer them on the chat. Mm,
Yeah, I think we'll stop the recording
yeah, that's fine.
first.
Yeah, so stop the recording, and if people want to stay to